Hey guys, welcome to my YouTube channel. So, firstly, I want to apologize for taking so long to upload part 2, but I've been occupied a lot. So, let's get into it. So, the topic for today is what to expect on your first antenatal visit, part 2. So, in the previous video, we spoke about what you should know and what information you should tell us on your first antenatal visit. Now, in this part 2 video, I'm going to tell you what we, the midwives or your gynecologist, is going to do to you. So, the first thing that firstly, you will notice that your information will be written in a different file. It will be different from the one that you are used to. So that file or book is called the maternity case book, or maternity case record, or maternity case file. It's just the same thing. And then secondly, you will be done vital signs. Now, vital signs is your blood pressure, your pulse, your respiration, and your temperature. The reason why they're called vital signs is because if there's anything wrong with you, the clues as to what might be the problem will start from there. Like, for example, if you have some sort of infection, your temperature will be a little bit elevated, or your pulse even maybe a little bit elevated. So it depends on what the problem might be, but most of the time they're all normal. So I'll do a video on what the normal vital signs are and what the abnormal ones are and what they mean and what to do about it. Then item number 3 is that you will be asked to take your clothes off so that you can be done a physical examination from head to toe. Now, the reason why we do that is so that we can also get just a baseline of your overall health status. So what we're gonna check for is your lymph nodes, for example. So we all have lymph nodes like submandibular lymph nodes and your axillary lymph nodes, your inguinal lymph nodes, just to check are they swollen or not. And then obviously if there's something abnormal, you're gonna be referred to a gynecologist. And then we're also gonna check your breasts for any abnormalities, like do they have lumps, are they the same size, like if you've got abnormalities then you can be referred. And then nowadays we also check your skin for any signs of being physically abused, so that you can be referred to the necessary people like social workers or psychologists, or if need be you can also be referred to the gynecologist or a doctor, just to verify, not to verify, but to note down your injuries and their extent in case you want to open a case with the police. Another thing we'll be checking during the physical exam is the size and shape of your abdomen. So let's say, for example, when we calculate your gestational age or how far your pregnancy is, and then maybe using your last normal menstruation date, for example, let's say we find that you are 20 weeks. Then when I measure your abdomen with a tape and I see that there is a huge difference, like according to your dates you are 20 weeks, but according to the tape you are 30 weeks, I find like 30 centimeters long, then that means it's an abnormality and you'll be referred for sonar at a gynecologist to rule out, maybe, for example, if you have multiple pregnancies. If you have twins or triplets or more, obviously your abdomen will be bigger, and that would mean you are now having a high risk pregnancy, and then you will have to be assessed by a gynecologist. But most of the time, if it's within the normal, if it's, let's say you are 20 weeks by date and then you are 19 by the tape, there's nothing abnormal there, as long as the difference is not more than 4, then all is well. Once the physical is, before I forget, we also check for your feet. Are they swollen or not? And if they're swollen, obviously you're going to be given advice and referred depending on how badly swollen they are. And then if you have diabetes, we'll also check the soles of your feet for any ulcers, so that you can be referred if you have. And then you'll be asked to put your clothes back on. And then I almost forgot, you will also be done, your blood sugar will be tested to see whether you do have high blood sugar levels or not. So it's very important that you just eat breakfast at home before you come to the clinic. Don't eat and then like 5 minutes later you are checked your blood pressure. It will just give, sometimes in some people it will be very high or close to high, then you find that will refer you for no reason. So make sure that you eat at home, then you have just a light snack at the clinic or at your gynecologist, so that we get the accurate blood glucose levels. So guys, activity number 4, you will be taken bloods will be taken from you. So the reason why we need bloods is for 4 reasons. We need to check for an STI called syphilis. I think a lot of you have heard about it, but it's syphilis, also known as RPR. So the reason why we need to check all pregnant women for that specific STI is because it can have fatal consequences if it is left untreated or if it is not checked. One of those things, it can cause miscarriages, it can cause liver problems in the baby, it can even cause the baby to have abnormal brain development. So it's very important that we check whether you have the STI called syphilis or not. And then the second blood test we do is to check for your rhesus factor. Now, a rhesus factor, I'll do another video to explain it in detail, but basically it's just to check whether it's positive or negative. The normal one is the one that's positive. And then the third blood test we do is your HB. In easy terms, in simple terms, what HB is basically how much blood you have in your body. That's it, guys. So if, for example, it is low, you will be given iron supplements just to supplement so that you have the correct amounts that you need in order for you to have a healthy pregnancy. And then the fourth test that we do is to check for HIV. Now that one, most of the time it is just done as a rapid test, the one where you get pricked on your finger and then you check, then you get your results same time. So the reason why we do that is because if you find that you knew your HIV status was negative and on that day you find that it has now changed to positive, the sooner you start with your antiretroviral treatment, also known as ARVs, it means the sooner your body will suppress the virus, and then that would mean that chances of your baby being born with HIV are and then finally, once all of that is done, you will be given your next appointment date according to how far along you are with your pregnancy, and also according to whether you are a high risk or a low risk patient. So I'll make an example. There is I'm not sure whether to call it a policy or a guideline that we follow. So it's called Bank Plus. So if, for example, you are 20 weeks today, you're 20 weeks pregnant today, you will come back when you're 26 weeks. So that is like another 6 weeks. But if you came today and then we find that you are 86 weeks pregnant, you will come back in 2 weeks time, because then you're closer to giving birth. So the closer you are to your date of giving birth, the how should I put it, the more you'll come to the clinic. So the closer your dates will be to each other, the closer your appointment dates will be to each other. And then right, so thank you guys for watching this video. Please like, comment, and subscribe, and share the video if you know of someone who is about to start their antenatal care and they don't know what to expect, or if you're interested in general, then you can share this video as well as my other videos. So on my next video, please look out for my next video. I will be talking about the normal ranges of vital signs. Like if you go to a health care facility and then you're taking your blood pressure, what is the normal range, what is the abnormal range, and what all that means. So thank you guys and have a lovely day.